Okay, good afternoon. Thanks for tuning in today. I'm Carrie Enright Cato, Director of the Office of Climate Change, Technology and Research at Connecticut Deep. Welcome to the Exploring Climate Solutions webinar series. This series is brought to you by the Governor's Council on Climate Change. On April 22nd, 2015, Governor Malloy issued Executive Order creating the Governor's Council on Climate Change, also known as the GC3. The Council is charged with examining the efficacy of existing policies and regulations designed to reduce greenhouse gas emissions and identify new strategies to meet the state's greenhouse gas emission reduction targets. The Council is composed of 15 members from state agencies, quasi-state agencies, businesses, and nonprofits. To learn more about the GC3, please go to www.ct.gov/DEEP/GC3. The webinar series explores innovative and successful climate change solutions in Connecticut and the nation. The series provides firsthand accounts of high-profile municipal climate programs, climate initiatives in the corporate world, new greenhouse gas reporting frameworks, statewide sustainability programs, low-carbon fuel initiatives, and other programs and projects that help reduce greenhouse gas emissions and improve climate resilience. Today, we're excited to have Madeline Priest from the Connecticut Green Bank, Kristen Sullivan from the Connecticut Department of Public Health, and Kate Klinger from the Green and Healthy Home Initiative. Our guests will be telling us about the Connecticut Green and Healthy Homes project. More specifically, the project is working toward the innovative statewide model to provide evidence-based housing, health, and energy services to low and moderate income Connecticut households. These interventions are directly linked with reduced energy burdens and improved health outcomes such as asthma, lead poisoning, or injury prevention. Educational achievement, financial stability, and quality of life for families. We look forward to learning more details about the project in the next hour. So upon completion of the presentation, we'll open it up for questions from the audience. If you have a question, please submit it using the question dialog box or the comment box, and I'll read it aloud for our guests to respond to. Before we get started, for those of you listening via your computer speakers, and if you're experiencing poor sound quality, I do encourage you to call in using a telephone. So with that, Madeline, I'll go ahead and turn it over to you to kick off the presentation. Thanks to you all for your willingness to present.
Great. Thanks so much, everyone, for joining us today. My name is Madeline Priest. I'm the Manager of Residential Programs at the Connecticut Green Bank. And we're really excited today to walk you through the issues, this research we're doing in collaboration with Department of Public Health and the Green and Healthy Homes Initiative, in addition to many other state agencies and program administrators for energy and housing. This research we're working on together is going to be addressing a handful of issues, so we'll walk you through what it is we're trying to solve for, and then what that means for our residents here in Connecticut, and then we'll spend some time outlining the model for the evidence-based solutions, and then at the very end we'll talk about where we are in the process in our research. And hold on a moment, there we go. So in Connecticut, we have some of the highest energy costs in the nation. We see Connecticut residents spending $5.12 billion dollars a year on heating and cooling, which is, just to kind of give you a framework, that's more than the state's budget for healthcare or education. And more than half of our low-income residents experience what's considered high energy burning costs, which is the concept of spending, the amount of percentage, sorry, let me rephrase that, the percentage of annual income spent on energy costs. So anything above 6 is considered high, 10 is considered more severe. And because of that energy burden, we see a gap in the ability to afford energy costs here in the state of Connecticut. And with that gap, that means residents are really being forced to make some trade-offs around paying utility bills or buying food or buying their children new school supplies or making energy or just general maintenance of their home. And that leads to a lot of deferred maintenance and issues with the housing stock, such as the existence of knob and tube wiring, mold and water leaks, asbestos, paint, carbon monoxide, radon. And as many of you know on the call, about 25% of customers going through the Home Energy Solutions Income Eligible program are unable to complete the energy efficiency work in their home due to the existence of these problems. That, I'm going to pass it over to Kristen Sullivan at Department of Public Health.
Great, thanks, Madeline. So why does housing matter to health? We know well-maintained housing lowers the risk of chronic disease like asthma, lead poisoning, and injuries such as falls and slips and trips. Even behavioral health issues, and even poor birth outcomes as well. As an example on this slide, I'm showing you two different conditions associated with poor housing, asthma and falls, including the burden and the associated costs. But we also see striking disparities in these areas by race, ethnicity, and age. So for example, emergency department visits for asthma are twice as high for the Hispanic and Black population. Falls are the leading cause of death for Connecticut residents 65 plus, and the fourth leading cause overall. The bottom line is that we want every Connecticut resident to live in a healthy, safe, and energy efficient home. You can advance that, Madeline, if you would. So we have the opportunity to change it, and that's the really exciting part about this. We can solve for the funding gaps for health and safety remediation. We have an opportunity to break down the silos on the funding side and the delivery side, and we can do this sustainably at scale all across the state. And that's really the exciting part of this project and the partners that have come to the table to work with us on this.
Great. So thank you, Kristen and Madeline. This is Kate Klinger from DHHI, and I think both of you framed that so nicely for us in terms of the need. I'm just going to say a bit more about some of the impacts that we're seeing with regard to poor quality housing from DHHI's national work. And so we know that families experience these impacts in a variety of ways, certainly with regard to their economic stability, their health impacts, and some of those physical health impacts are pretty well understood. And things that you may have heard of, certainly with regard to housing, but increasingly research is showing us that mental and behavioral health and emotional health, as well as childhood stress, are really closely related to housing quality in ways that we are just beginning to understand. In addition, all of those impacts certainly have influence the ability of children to succeed academically and of their parents to advance in their careers. And so each of these needs, or all of these needs together, really lead families to seek assistance from a variety of different sources. And what we're seeking to do, next slide please, Madeline, with this project and with Green and Healthy Homes work more broadly, Green and Healthy Homes Initiative work more broadly, is to break that link really by serving the families that we serve to really improve housing quality so that they may experience their full potential for success across the board. Next slide, please, Madeline. Looking nationally, we understand that the impact of poor or unhealthy housing, which HUD estimates 30 million families to be currently living in unhealthy homes, really has a very measurable impact in terms of over 14 million days of missed school each year. Asthma is the top reason that students miss school, and that's true in Connecticut as it is nationwide. Over 14 million missed days of work each year. And as Madeline alluded to, that energy burden, particularly for low-income families, where the 20% of monthly income that's going to heat their home and provide hot water for their family really is preventing them from building their assets, from attaining financial stability, and meeting other needs. Next slide, please. And so through the Connecticut Green and Healthy Homes Project, and again through our work more broadly, we're really seeking to identify a model for integrated housing, health, and energy interventions that can be sustainably supported through a variety of sources. And I'm going to just go through the particulars of that model as well as some strategies for sustainably supporting it in the next few slides. And so this may be this sort of evidence-based and at this point pretty standardized healthy homes model, healthy homes intervention model might be something that you're familiar with. And it begins with enrollment or intake of an individual based on particular eligibility criteria, typically the existence of a disease, of a health condition or disease, and really includes provision of very evidence-based services and interventions to that individual in that household, including education, resources, targeted remediation of hazards in the home, and especially in the case of asthma, also includes coordination and follow-up with medical providers to ensure that the patient is receiving medical case management that aligns with the improvement in the environmental conditions that underlie that disease or that health condition. And really ends up then with an evaluation that measures the impact of the intervention and meets the needs of the partners. So whether that's an actuarial analysis of the healthcare utilization and associated costs before and after the intervention, whether it's more of a robust case comparison evaluation that really looks at the broader impact of the intervention for the population that received it, versus a similar population that has not. Just that evaluation is really key in determining that impact. Next slide, please. And so the model for an integrated health and energy intervention includes within that intervention that I mentioned, the opportunity to provide a coordinated assessment that would include an energy audit, interventions that would address not only the health and safety needs of the household, but also the energy efficiency needs, and a coordinated scope of work that addresses the issues that might prevent that property from being eligible for energy interventions as well. And so in addition to sort of understanding the impact of the health and safety interventions, it's really important to quantify and capture the true value of just energy efficiency interventions in and of themselves. So one of the things that GHHI is engaged in along with other partners around the country is really attempting to measure the health, economic, and other benefits that accrue as a result of energy efficiency interventions to the individual, to the household, and even to the community. And so we, based on our national work, directly serving families as well as, providing technical assistance and informing policy and practice around the country, we're really seeking to build that evidence base that shows that energy efficiency interventions provide a variety of benefits and should therefore be supported by a variety of different sources and organizations and government agencies and other folks who are interested in promoting those benefits. One of our recently sort of released reviews of the evidence is called Weatherization: Its Impact on Occupants' Health Outcomes. Again, really just adding to that base of evidence. Next slide, please, Madeline. And so in addition to the health outcomes case and what we would call the sort of moral imperative to improve housing quality for families, there's also a business case to be made here. We know that for every dollar spent on lead poisoning prevention programs, we see a significant return on investment in the amount of $17 to over $200, and that there is an increased lifetime earnings for children as a result of avoiding the loss of cognitive function that happens when kids are exposed to lead. And of course, those increased earnings are also tax revenue, right? So it's a wealth builder sort of across the board for communities. And then for every dollar spent on environmental asthma interventions, sorry, that should say every dollar spent, we see a return of over $5 to $14. And those returns are more immediate. So some of the lead return on investment that we're talking about really accrues over the lifetime as a person continues to achieve academic and career success and increased earning potential. But on the asthma side, we're talking about direct healthcare utilization costs, avoided hospitalizations, avoided ED visits, and sort of the opportunity for return is across an even briefer period of time. We also know that 40% of all asthma incidents can be attributed to those home-based environmental hazards. So these interventions have a direct impact on the severity and frequency of asthma episodes and the associated cost of healthcare utilization. Next slide, please. And so some states are taking have recognized this opportunity for return and are really beginning to invest public sector healthcare dollars on addressing the underlying environmental conditions that cause these health problems. For example, in Maryland, they've recently devoted $7.2 million of their children's health insurance program funds to remediation of asthma triggers and lead hazards in housing. Michigan, which of course has had a lot of national attention focused on the issues around lead in that state, recently invested $119 million or committed to investing $119 million, again, of their children's health insurance program funds in lead hazard remediation directly. And in other states, Missouri, Oregon, Rhode Island, Texas, these kinds of initiatives are in the works. Next slide, please. We can skip this one actually, Madeline, sorry about that. And so it's really all about developing an innovative set of strategies, a funding toolbox to sustainably support these types of interventions. Whether it's investment from public sector healthcare, community hospital benefits investment, philanthropic investment, administrative claims, access to those dollars, really a set of sources of funds that can support different aspects of housing interventions sustainably in order to attain these kinds of benefits, again, at the individual household and community level. Next slide, please. One of the, I'll just briefly mention GHHI's work with Energy Efficiency for All, or the EFA Coalition, which folks on the call may be very familiar with, but it's a set of coalitions across 13 states that include advocates, housing folks, environmental justice folks, and others. And GHHI's role in this, again, is really to be one of the research and policy leaders who are supporting the evidence related to the non-energy benefits of energy efficiency interventions. Next slide, please, Mel. And so with that, I'm going to turn it back over to my colleague, Kristen, to talk about why Connecticut is uniquely poised for potential success in an intervention like this.
Great, thanks, Kate. If you could just turn to the next slide, please. So the first thing we did to sort of poise ourselves was to build a core group of key partners. The Connecticut Green Bank and DPH are the co-sponsors, and our role is to bring in the health world, both the public and private sector. And the Connecticut Green Bank brings the energy and the housing partnerships that are already in place. Some of these might be with the Department of Housing, who looks at affordable housing and community development, rental assistance. Others might be the utilities, where they have cost-saving energy audits. They do savings programs and solutions. The Department of Energy and Environmental Protection, who does energy assistance, weatherization, winter heating. We bring in DSS. We've been working with them, bringing them to the table as well. They have the Medicaid program. They also do aging in place programs as well. And then other partners that we've been bringing to the table are also DCF and the Office of Early Childhood. And these provide service to vulnerable populations. And basically what we find is we're all serving the same families. So it makes sense to bring us all around the table. And the third partner, GHHI, which you've heard from, bridges all these worlds with their work in the green and healthy housing, and that also works within the healthcare world of the actuarial-based clinical outcomes. And I think, as you heard from Kate, it's really helping us to craft a solution specific to Connecticut based on the experiences that they're having around the country, and the tools that they've identified that are in their toolbox that they've had experience using and building a specific solution with the other states. We're really excited to have the opportunity to both work with Green Bank and GHHI on this. Next slide. So we kicked off this project together back in the fall of 2017. It was a successful kickoff, provided us with a lot of momentum. During this convening, we invited probably up to about 100 stakeholders together to come together, learn about the project, the proposed project, and to identify different roles for our stakeholders moving forward. So we had the 7 agency commissioners around the table. They all spoke to how housing can improve the health of the vulnerable populations, and, you know, again, recognizing that we all serve the same families. Our energy partners in the Connecticut Green Bank spoke to the lessons learned from their innovative work in energy policy and sustainability. But it really showed tremendous buy-in for this project, and it was great to see how all the different areas are coming together around a social determinant of health like housing, and to really have that connection to energy use. Next slide, please. So I just want to give you a little, some information about the project moving forward. So right now, GHHI is helping us to develop that phase 1, we call it feasibility research components. And that includes an asset gap analysis, looking at how we can best leverage existing resources and what the funded programs are existing right now. And we've used some of our stakeholder groups to reach out to that were invited to the convening to really talk with them about what's already in place and where might some of those gaps be. You want to go to the next slide, please? And then another key piece of that feasibility research in the phase 1 is to really look at that return on investment and the potential payment mechanisms. And I think Kate took us through a toolbox of some of those potential payment mechanisms. Next slide. And so the last pieces of the feasibility research is really to assess our current capacity and our service providers to really scale this program statewide, and of course, to identify gaps in the data that we need to collect for health, safety, housing, and energy efficient programs. The data will also be used for an evaluation. Go to the next slide, please. At the end of phase 1, we expect a feasibility research report. We're going to be having ongoing partner convening meetings to engage our stakeholders and different groups to discuss some of these practices and opportunities and to present findings. This is one example. We've been presenting to different groups across the state that have an interest in this project and pulling them into our stakeholder engagement. Next slide, please. So the idea is to, based on the feasibility research that's being conducted, to decide about moving forward to phase 2. Some of this will happen a bit concurrently, but phase 2 includes a project design. And then phase 3 would actually be a pilot implementation where we really prove out that model to see if it works before it's scaled up statewide. Let's go to the next slide, please. Currently we're just finishing up the feasibility research with GHHI. And concurrently, we're also doing stakeholder convenings. We did that in the fall, but we're continuing to identify different stakeholder groups to convene and inform about the project and ways that they can participate. We'll also be starting to think about the pilot project design, and then the full feasibility report we hope to have out by spring 2018. The pilot project development and up to 3-year implementation and evaluation, that's a longer term. And we have set a target date right now for 2018 to 2021. So that's the target, sort of project management target piece for the project. And we invite everyone to be a stakeholder with us and to participate in any of the events that we have in the future. And I think that's it. And we can take it, unless anyone has any other comments from the presentation team, either Madeline or Kate.
Great. So this is Carrie. We'll go ahead and open it up to questions. If you do have questions, go ahead and type them into the message box. I'll start off with a couple. So what, are you working with municipalities at all? Since they seem to be an intersection between, the communities in which you are looking to affect.
So I will just highlight that right now we're still in the research phase. So we haven't started any implementation phases where we might be engaging municipalities to run pilots.
Yeah, Madeline, and I'll just jump in there too to say that that's certainly true in terms of where we are in this phase of the project. We are completing a pretty robust asset and gap analysis of around the statewide, as we mentioned, tremendous resources that exist in Connecticut, particularly in the energy efficiency space. And as part of that research, we've talked to somewhere around 40 different stakeholders across the state, and certainly municipalities, local departments of health, and other municipal providers and officials were part of those conversations. So we're really trying to get a sense of where municipalities are in Connecticut with regard to what they view as their assets, their resources, and the gaps in the services that they would like to be providing to their population.
Great, and as a follow-up, there's a comment that Middletown has started a program that is almost perfectly aligned with GHHI. How do we get involved in the pilot or the process?
I actually believe Emily Basham from the Connecticut Green Bank, who works for me, has been in conversation with some of the individuals running that, but they can reach out to us to get more information.
Great.
Yeah, Madeline, let's get them connected. That's great. Thank you.
Excellent. And folks on, participants viewing, contact information is up on the screen now, so I suggest reaching out directly. How does the program plan to work in rental versus ownership occupancy?
Kristen and Madeline, I'll take that one if that makes sense. So, as we've sort of talked about here, and I think Connecticut is fantastic because everyone is very excited and sort of already in a place where they're thinking about how do we put this into practice. And we've seen that across the board with folks that we've talked to statewide. The need is really well recognized and people are ready to hit the ground running. That being said, we are still in the research phase in terms of really trying to get a handle on how a sustainable model might look. And so a lot of those questions about how will housing be targeted, what will the eligibility criteria be, and those sorts of things are conversations that need to involve partners around the state. It's certainly not a situation where GHHI or Connecticut Green Bank or the Department of Public Health will say this is the model. It's got to be something that once we get to the point of designing, thinking about a pilot design and a broader implementation statewide, that we need to have partners at the table helping to inform those types of decisions. And so stay tuned is what I would say about that. And please, continue to be part of the conversation and help us to arrive at the right kinds of choices around those things.
Great. And is Connecticut a part of EPA? If so, what kind of help can they provide? I don't actually know the answer to that question. Do you all know?
Can you restate the question, please?
Is Connecticut a part of EPA? If so, what kind of help can they provide?
Energy efficiency for all.
Yeah. Yeah. I mean, I don't think that I don't think the DEEP is in particular. I mean, I don't think there's from the agency perspective. I don't know if Green Bank
I know we do a lot in partnership with them for our multifamily programs specifically. Yeah, I don't know if there's like an official Connecticut EFA coalition, or if any one group of people are a part of a broader coalition.
Yeah, and I'm just looking at the list of coalitions now. Oh, there's a little bit of background noise there. There are some organizations that certainly do a lot of work in Connecticut that are involved with EFA, and so I do think that there are connection points if folks within the state are interested in getting more involved. And certainly there's a lot of information about that, and I could provide more specific information too, sort of offline. But it is a great, coalition of folks, and they really are thinking broadly about how do we increase and grow support for energy efficiency in the places where we're working.
Great. Have you thought about the metrics to measure success? Are those things that you're talking about currently, or something that will come after the design phase or the research phase? Excuse me.
I think that's part of the research phase and identifying data and gaps in data. And should be probably part of the pilot design as well.
Sure, Kristen, and I would just say, and I don't want to keep repeating this, but those types of decisions again are really going to be informed by partners. I mean, there are some things that we know broadly we want to measure impact regarding certainly asthma prevalence, severity and frequency, healthcare utilization around asthma, household injury and lead exposure, changes in housing conditions, directly measured changes in terms of indoor air quality and the presence of lead hazards and injury risks in housing, as well as improvements in energy efficiency, reduced energy usage, and lowered utility bills for households. And I think where we might need folks to really provide input is in how do we measure some of those more community level transformative impacts of an initiative like this. What are some ways to really capture the value of that? And so, yeah, there are some places where we've got some great ideas and some places where we need some great ideas around that. Madeline, anything you'd add to that?
Nope, that was pretty succinct.
Great. So we have municipal energy task forces here in Connecticut. I'm sure you are all aware or heard of them. And there's a question about how to get them involved. How can they participate or contribute? Is it through the stakeholder process, or where in the timeline would a group like that be able to participate?
Sure. So there's a couple of different ways that energy task forces can participate. They can email me, Madeline Priest, and I can add them to our list of people who would like to be updated, kind of our informational contact list. Additionally, there is an opportunity through Sustainable CT, the initiative designed to help communities take on different sustainable and green practices. There's an opportunity through that as well to gain some more information around the connection between energy, health, and housing. So
great. And for folks on viewing, we did a presentation on Sustainable CT last month. So if you're not familiar with it for some reason, definitely encourage you to go back and watch that presentation. It's definitely an excellent way for municipalities across the state to get involved in a wide variety of sustainability issues. A couple more questions. So are these programs open to everyone who qualifies financially in the state, or are they primarily targeting city populations? Have the financial criteria been set yet?
So Kristen and Madeline, I can speak a little bit to that, and then have you jump in if you'd like. And so, I think the vision broadly in Connecticut is that anyone across the state who would have needs around these housing, health, and energy needs would have access to these services, have access to a holistic set of interventions that could meet all of those needs in one place. And so, you know, that's a big goal and sort of a really great vision, and it's something that certainly all the partners are working toward. We've had a lot of interest from rural communities across the state who really want to get involved. And one of the things we've identified certainly in our analysis thus far is that there are really sort of glaring gaps in the kinds of services that are available to more rural parts of the state. And so I think that is certainly part of the conversation. You know, and in terms of any specific eligibility criteria, certainly we're not quite there yet. But broadly speaking, I think we all share the vision of, you know, whether you approach this because you have high utility bills and you need energy efficiency interventions, and then you receive health and safety interventions as part of that, or you approach it because you have severe asthma and, you know, we're able to provide both health and safety interventions and energy efficiency within your property, that would be the goal.
Great. So unless anyone has any final questions, I think we'll go ahead and wrap up. And thank you to our guests. This is really interesting and exciting program to see coming into play. Really important, addressing really important issues that I think cross the energy and health spectrum. So thank you. For more information, I do encourage you to contact each of the presenters to get additional information or participate in the stakeholder process. So thank you, and I hope everyone has a great day.
Great, thank you so much.
Bye, thank you.